Hi, I'm Duc, and this is my third extra credit assignment. The first thing I want to talk about is Joseph's work with systematic desensitization. This involves a creation of a list of situations related to the person's phobia in the order from the least fearful to the most fearful situations. The patient will then be trained to relax under a certain situation. The person will then be asked to imagine their fearful situation, and when they experience no anxiety under a certain situation, they will then move to the more fearful situation. For example, the therapist will begin by asking the patient to identify a fear hierarchy. This fear hierarchy would list the relative unpleasantness of various levels of exposure to a snake, let's say. For example, seeing a picture of a snake might elicit a low fear rating in compared to live snakes crawling on the individual, which becomes the highest on the fear hierarchy. The second thing I want to talk about is Aaron Beck's cognitive theory of depression. This theory maintained that the main characteristic of depression is a distortion of reality, and that this distortion is present in the person's thinking and causes depression. Reality is interpreted as being more negative than it actually is. Then magnification in this theory is the exaggeration of negative aspects of a situation. On the other hand, minimization is to ignore or downplay the positive aspects of a situation. Magnification and minimization can be applied to three things: the self, which is how you evaluate yourself; the world, how you perceive the world; and the future, how you expect the future to be. The third thing I want to talk about is criticism of Beck's cognitive theory of depression. Many depressed persons are aware that they distort reality, so convincing them of this aspect does not help cure them. Magnification doesn't always lead to depression. People can exaggerate and vent negatively, but they don't necessarily feel or become depressed. The third thing is an inexperienced therapist trying to use Beck's techniques may make the person feel that they are being blamed for their depression. The patient, as a result, will become more depressed. And then Aloy and Abramson's theory shows that depressed people guess more correctly than normal people on the turning light test, because normal people have more illusions of control. The fourth thing I want to talk about is Martin's learned helplessness theory. According to this theory, depression is caused by a perceived lack of control over a situation. A person is depressed because they've learned to behave helplessly. Then, attributions are the explanations for why something happens. And the first kind of attribution is internal versus external, then general versus specific, and stable versus unstable. Depressed people are biased in the kinds of attributions they make toward an event. They often attach external, specific, and unstable attributions to positive events. On the other hand, they often attack internal, general, and unstable attributions to negative events. The fifth theory is George Kelly's personal constructs theory. According to this theory, What's important in the functioning of personality is not reality, but rather how a person interprets reality. Reality is subjective, and there are many valid interpretations of reality. Personal constructs in this theory are certain rules and distinctions we use to make sense of our experiences. Kelly then established fixed role therapy. To help a person to change their behavior, we must change how they think about themselves. So this therapy asks a person not to change what they do, but rather why they do it. For example, a person goes to a party but doesn't want to talk to anyone because they are afraid of being judged. In therapy, they would be told to go to the party and do the same thing, which is don't talk to anyone. But the reason isn't because of their anxiety, but because they think something like the other people don't interest me. The next thing I want to talk about is the requirements of psychology testing. Firstly, reliability. This is the most important aspect of a test. This refers to how consistent results are. Secondly, validity. A test is valid if it measures what you want it to measure. It is possible to have a test that is reliable but not valid, but it isn't possible to have a test that is valid and not reliable, because a test that gives different results, unreliable results, doesn't measure anything. Lastly, standardization. This depends on test characteristics, which is the type of test and who takes the test. A score on its own has little meaning, so you have to take into account other factors, such as who takes it and why they take it. The seventh thing I want to talk about is cognitive test, which measures one's abilities. There are two types of cognitive tests. The first one is achievement test, which measures one's specific ability, for example, arithmetic or memory, etc. The second type is aptitude test. This combines several achievement tests for the purpose of estimating overall skills. Let's say the IQ, intelligence quotient test. However, people think of IQ test as the measure of intelligence, but this isn't true. They can measure academic skills, but they can't predict how successful a person will be. The last thing I want to talk about is personality test. This test doesn't have right or wrong answers. The purpose of this test is to understand a person. Self-report personality test is the simplest form of personality test. It asks direct questions. The problem with this type of test is it is easy for a person to give dishonest answers. However, the benefit of it is easy to make and distribute, so many people can take it quickly. The second type of personality test is projective test. This test asks indirect questions, and this very complex to give, to take, or interpret the answers. The benefit of this type of test is it's very hard for a person to fake their answers, because a person has no way of knowing how the answers will be interpreted. Project tests also provide a lot of information that self-report tests do. The problem with this is it needs a highly trained person to administer the test, and it is usually not the only one person at a time can take it. It often takes a long time to take as well. It is also hard to compare results across persons, so reliability is lower than self-report tests.